Okay, let's look at something else. You're probably familiar with, if you're not familiar with these pictures, you should be. Healthcare Commission reports on Stoke Mandeville and Maidstone C. diff outbreaks. One of the reasons why they had these C. diff outbreaks was that they were so obsessed with their MRSA targets, they took their eye off the C. diff ball. And these outbreaks went running for quite a long time before anybody twigged there was an outbreak. If this had happened, if a restaurant had poisoned as many people as these hospitals poisoned, it would be an outrageous scandal, and the restaurant would be pilloried and sued and closed, and well, anyway. These are their control of infection procedures. You put a trolley at the foot of the bed. It beggars description. This was after the Healthcare Commission had announced they were coming. This wasn't something that a spot inspection. And this is how close the beds were together. If I do anything else in my talk, I think the most important thing is to advise you to read those reports of the Health Commission. You can get them on the web. They are really very, very, very important in terms of telling you what can go wrong in a hospital at all levels, and the problems with targets, or rather getting the right targets, and so on. So this just summarises it. The big disappointment for me, which shows that learning is very poor. We can have scandalous outbreaks, dramatic outbreaks, hit the headlines, reported, inspected, worked out, we know exactly what went on, and yet we're still not putting into practice the things that we're learning from these outbreaks. So we owe it to the patients who suffered in those outbreaks, and particularly those who died, to actually sort things out. You can see these outbreaks: Stoke Mandeville, Maidstone, and then availably we had one in Scotland which had similar issues, that information was collected but not passed up the line, control of infection committee was being reorganised. Won't go into the details. There are 2 reports there on the web as well as to what's happening there. And we've got a public inquiry running in Scotland now to look at the circumstances around that outbreak, which of course was entirely preventable. We might well have C. diff background. We've got patients who need antibiotics. C. diff, will develop. You can't eliminate C. diff. We might be able to get rid of MRSA. We're going to be left with MSSA. We're going to be left with C. diff. It's out there in the environment. So that's just to remind you, these bugs are not going to go away, however well we sort out our preventive measures. But we can prevent the preventable parts. Well, that's what we're doing in Scotland with C. diff. It trickles on. It's going down a little bit.